So some of you guys might be wondering why I have my ACL patients do these weight exercises with lasers and targets, or have them count or recall items, or even do math while they do their exercises. And here's why. So in your brain, there's an area located right around here on both sides. It's called your primary somatosensory cortex, and it's responsible for the sensory mapping of your entire body. So here, for example, is going to be responsible for the sensory information in your legs, and here your trunk, and then your arms and face, and so on. Well, your ACL actually occupies a pretty big chunk of your primary somatosensory cortex, and it tells your brain where your knee is in space, particularly if your knee is straight, how straight, if your knee is bent, how bent. Unfortunately, when you tear your ACL, that information goes missing. And on top of that, surgery can't repair it. So your brain is missing some key information on where your knee is in space. So what does it do to make up for that? Well, your brain likes to draw from other areas or other resources to figure it out. And one of the areas it likes to pull from is this area, your posterior inferior temporal gyrus, which is responsible for visual processing. This area is going to be really active when you're trying to recognize faces, shapes, numbers, patterns, figures, and etc. The other area it likes to pull from is this area, your premotor and supplementary motor cortex, which is responsible for cognition with complex motor tasks. So this area is going to be really active if you're trying to learn how to skateboard or trying to learn how to juggle, for example. So in sum, your brain likes to pull from its visual and cognitive resources to figure out where your knee is in space. And how this manifests in the clinic, and how I see it manifest, is that when I consult with someone who's had an ACL surgery many years ago and had not the best rehab, they'll tell me that when they're walking and stepping over a curb, that they have to look at the curb to make sure that their foot clears it. Or when they do a double leg activity like running or squatting, that they have to think really hard to not baby their leg. As you can imagine, this is even worse in sports, as your vision and cognition is being occupied by the sport. That means your brain doesn't have the resources necessary to optimally use your leg. And we think that explains why when people go back to sport after ACL surgery, they're typically a shell of themselves. And on top of that, we also think that explains why re-injury rates of the same leg, but also the opposite leg, are really high. And on top of that, the adjacent joints. So yes, it's my job as a clinician to address the changes that happen to the knee, but I also have to address the changes that happen to the nervous system. And how I do that is I steal my patient's vision and cognition while they do certain exercises in the gym.